Hi, my name is Tracy, and I'm the nurse taking care of Millie Larson. First off, we're going to see her MAR. Her MAR says her name is Millie Larson. Her birth date is 1/1 of 1936. Today's date is 10/18 of 2020. Her medical record number is 123456. She has no known allergies. Her MAR states she's getting furosemide, 20 milligrams IV push every 12 hours, administer over 2 minutes, flush with 3 milliliters of normal saline before and after. This medication is to be given now for edema and blood pressure. She's also getting insulin, Lispro, 10 units, subcutaneous with breakfast. It's also to be given now for blood sugar. So in front of me, I want to make sure that I have the right medication, the right dose, the right time, the right patient, and the right documentation. The first thing I want to do, again, she has no known allergies. I need to do my hand hygiene. So while I'm doing my hand hygiene, I'll just go over the supplies that I have. I do have in front of me, I have her furosemide, 100 milligrams, 10 milligrams per milliliter with the expiration date of 5 of 2028. I have her insulin, which also has an expiration date of 10/2027, and there's 100 units in here, but it's 10 milliliters. I have her normal saline flushes in front of me. I have two of those. They're 10 milliliter syringes and they expire 5 of 2021. I have the 23 gauge 1-inch needle for the furosemide drawing up her medication. I have the 3 milliliter syringe. I also have my insulin syringe, which is a 1 milliliter 29 gauge 1/2 inch. I have my identity band. This says Millie Larson, date of birth 1/1/1936. I have my tape, I have my sharps container, and I have 2x2 gauzes in case I need them, and I have gloves. The next thing I'm going to do is I'm going to triple check my medicines. I've checked them once. I need to check them at least 2 more times. So furosemide, 100 milligrams, 10 milligrams per mil. She's getting furosemide 20 milligrams. So she's actually going to get 2 milligrams and 2 milliliters because it's 10 milliliters per mil. She's getting 20 milligrams, and the expiration is 5 of 2028. Again, her insulin Lispro is 10 units, 10 of 2027 with meals. One more time, furosemide, it is 10 milligrams per mil. She's getting 20 milligrams, so she's going to get 2 milliliters, expiration 5 of 2028. Insulin Lispro, 10 units, subcutaneous with breakfast, expires 10 of 2027. So the first thing I want to do is I want to make sure I get all my medication drawn up. So we're going to start with our insulin first. So the first thing we need to do with our insulin is we need to take our alcohol pad and clean the top of the vial for 5 to 10 seconds. Making sure we get that all clean. Then I'm going to take my insulin syringe. Take off the cap. I'm going to take it to 10 units. Putting 10 units of air into the vial and push that in. I'm going to turn it upside down, pull my 10 units out, making sure there's no air. Pull that out, and we're going to recap this very carefully. I'm going to take my piece of tape and I'm going to label it. It is Lispro insulin, 10 units. I'm going to label my insulin. I'm going to take my 3 milliliter syringe. I'm going to add my needle to that. Take the cap off of that. We're going to get it to 2 milligrams. I'm going to recap that just for a second because I need to clean off the top for 5 to 10 seconds. Again, that's furosemide 20 milligrams IV push. She's going to get 2 milligrams or 2 milliliters. It's 20 milligrams. Once that's clean, now I can go ahead and invert that. Turn it upside down. Get my 2 milligrams, 20 milligrams, 2 milliliters. I really do know how much she needs. Once that's done, going to recap that needle. Twist this off, and this is going to go into your sharps container. And then we are going to label this as her furosemide 20 milligrams, 2 milliliters. Once I'm done with that, I need to make sure to provide privacy for my resident. I also want to make sure I do some hand hygiene. I'm going to go to Millie's door. I'm going to knock on her door. I'm going to ask to see her identity band. On her identity band, it'll have Millie Larson, date of birth 1/1/1936. And I want to make sure that we'll make sure I have the right patient, right medication. It's to be given right now. I want to make sure that her date of birth matches, which it does. I'm going to explain to Millie. Millie, we are going to give you your insulin shot in your abdomen, 2 inches below your navel, on the left-hand side. And then I'm going to give you an IV PuSh medication through your already inserted IV. And then I'm going to make sure that you're in about a 30 to 45 degree angle, which is semi-Fowler's, to make you more comfortable. Okay. So again, you've got your furosemide 20 milligrams, 2 milliliter. It's going in the IV. And we have our insulin, 10 units, subcutaneous, going in the abdomen. So I'm going to put my gloves on. Millie, I'm going to clean your abdomen with an alcohol pad, starting from the inside, working out. And I'm going to let that dry. Once that is dry, I'm going to uncap my needle. I'm going to grab the abdomen and give it a little pinch. And then we're going to insert your needle and give you your insulin on the count of 3. 1, 2, 3. And we're going to insert your 10 units. I chose the 90 degree angle because it's easier for me. Once it's done, I'm going to engage the safety on that. I've got a 2x2 gauze. If she's bleeding, I can pat on that. When that's done, I'm going to put that in my sharps container as well because it's got blood on it. If I would need to change my gloves, I could here. Our next one is her IV PuSh. So I'm going to take my alcohol pad and I'm going to clean my saline port on the saline lock. I'll make sure it's open. And again, I'm going to go ahead and take my normal saline flushes and I'm going to attach that. I'm going to pull back to see if I get any blood, and then I'm going to push 3 milliliters in, 3 cc's. Normal saline. Once that's done, that's going to go into my sharps container. I'm going to get my insulin or my furosemide, attach that, and push. This goes over 2 minutes. So we're going to push this in over 2 minutes. So once that is all injected, the 2 milligrams, you would throw away your syringe. And I'm going to grab my normal saline syringe and we're going to do another 3 milliliters. Once that's done, I want to make sure to lock the lock back. Make sure there's no redness, no swelling around her injection site of where the actual needle or the IV is inserted. You don't want any signs of infection. So just check that while you're here. When you're done, I'm going to take my gloves off and I'm going to perform hand hygiene. And I would talk to Millie. Millie, I want to make sure you're in a comfortable position before I leave the room. Can I go ahead and, would you like to sit up? Would you like to lay down? She would like to lay all the way down, so I put her bed flat. I'm going to give her call light. I'm going to make sure that she doesn't need anything else. I'm going to thank her for letting me take care of her today. And then I am going to tell her I will be back in a little bit if she needs anything else. I'm going to come outside the room and I'm going to document. On her MAR, it says furosemide 20 milligrams IV PuSh every 12 hours. Get it to where you can see it. With 3 milliliters of normal saline before and after. So I would sign that I gave it. At this time, there's not an injection site, but I did assess the IV site, and there was no signs and symptoms before or after. Her insulin List Pro 10 units, subcutaneous with breakfast. I went ahead and signed that I gave it. I actually gave it in her abdomen, but there's not a code for that, so I put it down here, abdomen, as the injection site. And I think that is all. Thank you so much.